Hey guys, Greg with Mountain Physical Therapy. Today I want to talk to you about the hinge movement pattern. Typically when I'm speaking with my clients about the hinge, I'm referring to squatting down to a chair or bending over to pick up their grandchild. All of those movement patterns start with the hinge. One of the first issues I see with the hinge is having poor lumbopelvic rhythm. Now what that means is as you bend forward, your lumbar spine segments stay in extension and they don't really move very well. One way I like to get the pelvis and the lumbar spine moving is by performing pelvic tilts. When performing a pelvic tilt, lie on your back with your legs bent. Imagine there's a glass of water on your belt buckle. Roll your pelvis towards you, squeezing the glutes to dump the water all over yourself. Now release that and you'll go back to your neutral spine position. To go the other way, imagine you're dumping that water away from you and arching the back. When performing both of these motions, we want to use the hips to produce movement. You should feel like your upper body is getting pushed and pulled with either direction. Another common issue is trunk stability. Similar to the pelvic tilt and finding a neutral spine, we're going to now focus more on the muscles to help provide stability to the low back. So when we're performing a hip hinge in a standing position, we want to engage the trunk, keep our rib cage down, and have a band pulling us back. As Ryan performs the hip hinge, the band pulls his hips back. He keeps a neutral spine, core is engaged as he stands up, squeezes his glutes through, and does not go into hyperextension. Another issue I see with the hip hinge is having poor glute strength. When we want to strengthen our glutes, we want to do it in a hip hinge pattern. The first one I like to do is with a bridge. So keeping the core engaged, finding your neutral spine, you're going to push through your heels, lift your butt up in the air, squeeze your cheeks, and back down. Trying to avoid going into hyperextension and back down. Sometimes you'll have your hamstrings cramp. A quick and easy fix with that is lifting your toes up, pushing through your heels, and again, squeezing your cheeks. We want to try and focus on our glute activation as we're doing the bridge. If you find the glute bridge on the floor was too easy, you can do a motion called the hip thrust. Using a bench, place your shoulder blades on the edge of the bench, engage your core, tuck your chin, push through your heels, and elevate your hips. Squeeze your glutes at the top and come back down. If you want to make this even harder, you can grab weight to place over your hips as you come up. Make sure you're squeezing your glutes. I hope you found these tips helpful in improving your hip hinge movement pattern. If you have any questions, let us know. Thanks for watching. Have a great day.